Welcome once again to our Viva section. This is internal medicine, and these are sample questions from October 2022. Normally for every section, they always bring some few questions from the previous time. So please, if you are new here, do well to subscribe for more of these. And if you want the theory parts and the MCQ, you can find them on medentweb.com. medentweb.com. All right, so let's begin. So one of the few questions they were asked is, or are, differentials for headache and a fever in a senior high school student from Tamale Secondary School. So basically differentials for headache and then fever, basically. All right, the physical examination of neck stiffness and the Brzezinski sign. You know, some of these signs basically talks about meningitis or meningism, right? So physical examination wise, how are you going to elicit neck stiffness, Brzezinski, and all those stuff? So please learn how to do them. Then chest expansion demonstration. Chest expansion demonstration. And over here, you were given, or they were given, a chest x-ray of a pneumothorax. Chest x-ray of a pneumothorax, and was asked to find, we're asked to do chest expansion exam. All right, so I think basically what they were given is an x-ray to be able to tell what it is, all right, and to be able to find out the examinations or the physical findings you are likely to get doing chest examination. All right, for example, all of those things basically. So the fremitals, the chest expansion, whether it is symmetrical or asymmetrical, and all of those things, basically, all of those things. All right. So I'm sure they were just giving an x-ray to be able to do that. All right. Then an x-ray of a large area of opacification. So again, it looks like it's the same kind of question, right? Opacification means some kind of whitish appearance on the x-ray, which could, in pneumothorax, it will be more dark, right? But when there's fluid or consolidation and things like that, you can see some opacification. All right, so you say an x-ray of a large area of opacification was given. They were asked to describe what it is, to perform again chest exam. So what I mean is that you must be able to tell when you are given an x-ray to explain. You must know what they all mean. And luckily for us, you can check some of my videos. I've done a whole discussion on how to read chest x-ray, how to read the chest x-ray, the ABCD format. Very easy to follow, all right? So to describe the findings or whatever they saw, all right. Then make a possible diagnosis. All right. So a picture of a swollen leg was given. Differentials. You are thinking of a lot of things, the DVTs, the cellulitis, and so on and so forth. Lymphedema, yeah, they are all possible, right? All right, so to describe what it is, then risk factors. So what are some of the possible risk factors? For example, DVT, for example, cellulitis, you should be able to tell them. Then what organism can cause it? So anytime I hear organism, then one thing that comes to my mind is possibly they were thinking about, how do you call it? Cellulitis. Or maybe, and one thing about GMDC is that when you mention something, they will ask for a follow-up. So I'm sure based on the person's differential, person want to mention cellulitis, and the asked question is what organism can cause it. So very important. The medication to treat it. medication to treat it. So again, it depends on what you mentioned and how to go about its treatment. So please take note of that. Again, if you really want more of these things, try and get onto medentweb.com. You have everything over there for you. And you're also new here, please do it to subscribe, like, and share. All right. In my time, I was asked to show the apex beat. And I was talking. I'm like, the apex beat is no. I say show. That means they will give you, not a real life video, but something to be able to demonstrate where the apex beat can be located. So they were asked to do what? It's the apex beat definition and not the location. So defined apex beat. Defined apex beat. Now, I like to make this one very interactive, so please do well to write your answers in the comment section so that this can be very, very, very interesting. Let's learn from each other. However, if you want more and you want me to answer them, then I'm going to have to do another video so that this video will not be very lengthy. All right. Now, chest pain differentials. Again, in June, I remember I posted something about this, like Viva, and now they got it in October. So possible to get it in February. A child with yellowish eyes, differential. So basically jaundice. What are your differentials for jaundice? What are some of the things that can cause jaundice, basically? And there are a whole lot. Now, what are the infectious causes of the liver? Infectious causes of the liver. Then hemolysis. I think I'm basically telling you the differentials, isn't it? All right. The differentials and management of hemolytic anemia. Differentials and management, hemolytic anemia. So please do well to learn some of these things. The sickle cells are there, the sepsis, the whatever. Please do well to find answers to some of these things because you can't get it in your exams. All right. Then what is hypertensive emergency and urgency? Again, I said this the last time that I did a video on the Viva. Difference between hypertensive emergency and urgent. What I used to do is, because E starts for the emergency, I would say this is what the most end organ damage, because one comes with end organ damage and one doesn't come with end organ damage. And I use the E to always remember that this is end organ damage. So that is what hypertensive emergency. All right. Now, how do you diagnose hypertension? Very important. Sometimes people come to the hospital and they just check, they just get above 140 and above 90 and they conclude hypertension. But no, that is not how to diagnose hypertension. At least 3 times different. It can be different occasions. It can be different settings, but it should be around the same place. All right. Complications of hypertension. So for me, after hypertension, every part of your body is under attack. Anywhere blood vessel passes, there can be a complication. So please try and read. And hypertension is a high yield topic that you should be able to know. All right, high yield, because it's very, very common in our settings. Hypertension and diabetes, very common in our settings. And I can add asthma, very, very common. So if they ask you a question on some of these things, and don't forget malaria, if they ask you a question on these things and you fumble, I mean, they'll be disappointed and passing will become very difficult because these are the cases that we always manage. Now, what are the drugs that you can use to treat hypertension and their side effects? Again, I remember I was given a question like this, all right? And I want to mention furosemide in the next thing. What are the possible side effects of furosemide? All right. Causes of upper GI bleeding. Again, another high yield topic or high yield question. GI bleeding, very, very, very common. All right. So how do you manage it? What fluid are you going to give? Please, colleagues, if you have answers to some of these things, please put them in the comment section so that we can all learn from you. However, if you all want me to still answer them, then please let me know in the comment section. Then I will do a separate video on this. But in my next video, I want to bring another topic, all right, or another discipline. Okay. Now, identify. So they were giving a pulse oximeter to identify and then describe or tell them the uses of pulse oximeter. Pulse oximeter. You know, it's one of the most important, should I say, tool, yeah, for checking the oxygen saturation. All right. Now, what are the signs of respiratory distress? Welcome to you. The person is respiratory distress. And normally, in our general examination, we said patient has no obvious respiratory distress. What does it mean? What does it mean to be in respiratory distress? A lot of factors must come to play. Your way of breathing, very important. All right. So please find out signs of respiratory distress and share so that we can all learn from you. Conditions that can cause dyspnea. Again, difficulty in breathing. Conditions that can cause it. I told you about malaria. Very, very high yield. And again, I said it and they got it. All right. So please, some of these things, we're not joking. When my students go and then write the exam, I actually ask them to remember some of the questions so that they can, pre-inform us who are about to also write. So you can be well prepared for the exams. All right. So if you also do your own exams, please do well to gather some questions so that you can also help your brother or your sister who will be writing next. Okay, so causes of malaria, investigation, prevention, and treatment. I will not even talk much about it because it's very, very common and you should know everything about malaria. All right, so basically, this brings us to the end of the presentation and I hope you enjoyed it. Please like, subscribe, and share. And don't forget to visit medentweb.com. I'll put a link in the description so that will make it easy for you. All right, so let me know in the comment section what next you want me to upload, and I will do justice to that. Stay blessed.